Welcome back to MedTerm Basics with Ms. Sherman, based on the short course book by Davy Ellen Chabner. Today we're going to talk about Chapter 4, Prefixes. We'll talk about that little part at the beginning of some terms and how it completes our terms, what kind of information that it adds. Prefix categories. We can group prefixes together in some general categories based on the type of information they add to our terms. It's not important that we memorize what prefix goes into what category. Many of them fall into multiple categories, but it can help us when we're studying to just kind of understand what type of information a prefix adds to us. So we have categories such as time or timing, number or amount, location or direction, and a quality like good or bad. Let's start with time and timing. Okay, so we're going to look at time and timing prefixes first. We have neo. Neo means new. Neonatal, a newborn. Post. Post means after. Post-mortem, after death. Pre. Pre means before. Prenatal, before birth. Syn, together. Syndrome, occurring together. Brady. Brady is slow. Bradycardia, slow heartbeat. Tachy. Tachy is fast. Tachypnea, fast breathing. Let's look at number or amount. Uni is one or single, unilateral, pertaining to one side. Bi is two, both, bilateral, pertaining to both sides. Tri, three, tricuspid, 3 points. Quadri is four. Quadriplegia is paralysis of all 4 limbs. For amount, we have hemi, is half. Hemigastrectomy, removal of half of the stomach. Hyper is excessive, a lot of something. Hyperplasia, excessive increase in formation. Hypo is deficient, not enough of something. Hypoglycemia is a blood condition of deficient sugar, low blood sugar. Poly is many or much, again, a lot of something. Polydipsia is a condition of excessive thirst. A or an means no, not, or without. Apnea is not breathing. Let's look at prefixes for location. Ec or ex, out or outside. Ectopic, out of place. Excision, to cut out. Endo, within. Endoscopy, visual examination within or inside the body. Epi, above or upon. Epigastric, above the stomach. Inter, between. Intervertebral, between the spinal bones. Para, beside or near. Parathyroid, are the glands beside or on the back of the thyroid gland. Peri, surrounding. Periosteum, the tissue surrounding bone. Retro, behind. Retroperitoneal, behind the abdominal lining. Sub, below or under. Sublingual, under the tongue. And let's look at some directional prefixes. Ab, away from. Abnormal, away from the rule. Ad, toward. Adduct, move toward the midline. Dia, through or complete. Diarrhea, flow through. Trans, across or through. Transdermal, through the skin. And finally, let's talk about just a couple of prefixes that describe a quality. Like dis, Dis means bad or difficult. Dyspnea, difficulty breathing. Eu is good. Euphoria, a good feeling. Mal is bad. Malpractice, bad practice. Well, thanks for hanging out and learning a little bit about prefixes and medical terminology. We talked about some categories of prefixes just as a way to help us understand the types of information prefixes add to medical terms. We talked about time or timing, number and amount, location and direction, and some qualities. Thanks for joining. We'll see you in other videos.